Hello, hi, good evening. In this video, we're gonna talk about some kind of scientific topics or some kind of engineering topics. Okay, my topic is all about pacemaker. I hope some of the people may heard about this word, before, like pacemaker. No, I will tell you. What do you mean by pacemaker? Why we need that, and what kind of it is? What kind of surgical procedures are involved in that, and what kind of what are the types of pacemaker? I'll tell you each and everything. Just stay tuned to watch it. Okay, now just let's dig into the topic. Okay, first I hope you people know how heart functioning, right? Heart is a pumping machine which is inbuilt or which is incorporated into your body, which delivers amount of blood or the adequate supply of blood. No, it will supply blood to other parts of the body. I know every people know about that. Okay, knows about this topic. And pacemaker, why it comes into picture, I'll tell you. Okay, in our heart we contain it contains a natural pacemaker, which is a SA node, okay, sinoatrial node, which delivers some kind of electrical impulses to the heart to provide contraction of the heart, which pumps. Contraction and relaxation will be occurring in a simultaneous manner, or like from the atria to the ventricle, then ventricle to the lungs, from the lungs to the left atrium, and from left atrium to the left ventricle. From the left ventricle, it get delivered to the entire other parts of the body through the aorta. Okay, this is the quick description about heart and how it's functioning. Okay, if there is any problem with this SA node, means that electrical impulses not get delivered to the heart, right? Then there is a problem with the contraction and the blood supply, and everything will get disturbed. So that's why the pacemaker comes into picture. What it does, okay, the pacemaker is a kind of electronic device. It's a kind of an electronic device which can deliver certain amount of electrical impulses to the heart, so that the heart can functioning, so that the heart can resynchronize the normal function, right? It can function normally. So it requires a kind of impulses to initiate its beating, right? So that's why the pacemaker actually plays a vital role. Okay, if you're having any like if you're having any chest pain which is angino, means of course there is a low blood or low amount of blood supply in your heart, so it will cause your for chest pain and all. So that's why. And that pacemaker which is implanted in your body delivers some amount of electrical impulses to the heart. Through that impulses, the heart starts functioning properly, starts beating, starts contracting, and after contraction, after contraction of the upper chamber, the blood from the upper chamber gets delivered into the lower chamber, which is nothing but ventricle. Through the ventricle, the blood will deliver into the other parts of the body. Okay, right? Okay, I'll tell you. And what are the types of pacemaker are available? I'll tell you. Okay, single single lead, dual lead chamber, and biventricular chamber. Okay, single lead chamber in the sense. Okay, I'll tell you. No, pacemaker, it contains actually three leads: one lead, and second lead, and third lead. In single lead chamber, it contains only one lead. Okay, if it is applicable only like when there is a problem with the right side of the heart, right atrium or right ventricle, there's like a small procrastination of blood supply is there, means then the lead get inserted into the right atrium or to the right ventricle. Okay, anywhere. Okay, just placed, it just inserted into that area. Okay, then it will use that electrical supply or electrical impulses to that particular zone to start beating us or to start functioning properly. Okay, this is all about single lead chamber. And if it comes to when it comes to dual chamber pacemaker, means it contains two leads. Okay, first one lead is attached to the right atrium and another lead is attached to the right ventricle. Okay, it gives their electrical impulses to both the regions of the heart. In the sense, right side of the heart, it gets delivered the kind of impulses to the right side of the heart, so that it start functioning properly. Okay, the third case, biventricular. In the sense, it contains three it contains three leads. One is attached to the right atrium, and another one is right ventricle, and another one is to the left ventricle, which is used to synchronize the contraction of both right ventricle and the left side of the heart, or the left ventricle. Okay, which because from the left side of the heart only we are getting that oxygenated blood to our body, right? So it's very much important to know that left ventricle should work properly, then only we can get the adequate blood supply to our heart, to our body. So, and this is all about the types of pacemaker. First one is single, dual, and biventricular pacemaker. Okay, depend upon the leads we are calling them, like single, dual pacemaker, single lead pacemaker, or dual lead pacemaker, and biventricular pacemaker, like that. And okay, well, now we'll dig into the surgical procedure, how they're actually implanting that pacemaker into our body. There are two ways are available, two ways are there. One way is endocardial, okay, transvenous type, and another one is epicardial. Okay, first we'll go to the endocardial. Okay, endocardial in the sense, first the clinician makes some incision, okay, on the clavicular bone, which is which is lower to the shoulder bone or nearer to that. Okay, they are making some incision on that particular area. After that incision, the lead is then inserted through the venous system and through the veins into the exact location, into the heart. Okay, after that, after locating the leads in a proper location, then the pacemaker finally fixed in like a pocket in the clavicular region itself. It's get placed over there. Okay, after then, after locating the pacemaker and the leads in exact location, then it will start functioning automatically. Because and the lifetime of a pacemaker would be 8 to 10 years approximately, or accurately 8 to 10 years. Okay, and at the middle, if there any problem arises, there is any faults, or is there any problem with the deliverance of the electrical impulses, or there is, or some kind of damages will occur, means that concerned person will do and take the analyze the condition of the pacemaker and as well as the patient and what's the actual problem, then they will take an appropriate step to resolve the problem as well. Okay, and this is the first endocardial transvenous system. It is the most widely used and adopted technique. Okay, mostly clinicians go with this type. Okay, another system, no, another type is also there. That is epicardial. Okay, it is mostly for kind of children, or if the patient is undergoing some other kind of heart surgery, so some other like that, means the clinician will take this as a tool to perform that implantation. In the sense, they are making that incision in the abdomen region. Okay, below the below the abdomen or the chest region. So after insertion, they are just inserting that leads into the epicardium. Okay, in that case we are inserting that leads into the exact location, like right atrium or something like that. In this type, we are inserting that leads into epicardium. Epicardium, in the sense, it is the outer layer of the heart. We're just placing our leads into the epicardium. Okay, after that, after the successful implantation or insertion, then the pacemaker is just placed over there only, like in the abdomen region. So after then, it starts delivering that impulses into heart to function properly, or to function to resynchronize their normal heart function. Okay, these are the two types of surgical procedures that involved in pacemaker implantation. And also we have discussed about what are the types of pacemakers are there, and what are the surgical procedures, and actually what do you mean by pacemaker. Okay, I hope you got some clear knowledge about it. If you're still having any doubt about this topic, just let me know in the comment section, so that I can make it clear. Okay, I'll try. And if you're not subscribed to my channel, please do subscribe it and press the bell icon too. And if you really like my video, just give a thumbs up. Okay, thank you so much for watching, people. Bye bye.